And yet it seems unlikely that even the president can deliver a waiver on Medicare or on federal employees or military retirees.
Well, let me just say,
Governor.
Governor. But let me just
Sorry, let me just finish, Governor.
All right.
That so in fact, you're not going to be able to enact a single payer program.
Yeah, we are.
Which, well, by definition, if you've got Medicare, TRICARE.
Will you break us off before we try?
No. I'm actually just saying what's true. And that is that you can have a publicly financed program, and as Deb said, it won't be single payer. That it will be enormous progress, but let's not confuse it with single payer, because you will give up much of the administrative advantage of a single payer program. And the other concern that some of us outside...
Let me just say, I agree with you, but I'm going to try to get the waivers to get everybody in the pool. Everybody. I want everybody in the pool.
That of course, will take an act of Congress. But
that's right. If you help me get rid of those Tea Party nuts in 2014, I'll get it done.
One last thing, which is the other source of concern is that the movement to ACOs in your state, and it is an ACO that is a for-profit corporation that is the dominant provider in your state, which essentially is a private planner of healthcare in your state, is a great concern. It's a move to an organization for which there is no evidence that it will save money or improve care. And those of us outside have grave concerns about that as the first step to single pay.
Okay, let me just be clear, because I don't want to answer that. And you make a good point, but let me make it clear. Listen, I was not governor when the Affordable Care Act passed. As a governor, I had two choices. Implement the bill myself with federal dollars, or have the federal government do it for me. I chose to go it my own way. That doesn't mean that I believe that the Affordable Care Act is my best friend. So don't confuse what I have to do under federal law as a governor and where I'm going in 2017.
All right, thank you so much.
So I think state-based efforts have obvious political attractions. It's hard to imagine working in Washington in this day and age and getting them to move. And states are much closer to us. Our activists have much more access to state officials. The government is much easier to move. I might say that holds for those of us in blue states. We need to also remember that there are a large part of our population that lives in red states. So I'm looking at Pippa Epstein, who's from Alabama. And it may be that state-based efforts are much less attractive there. But there are obvious political attractions. And I think the Vermont example is the outstanding example of why it is that state-based work really feels like it can advance the cause of our efforts. Marvin has outlined some of the obstacles, and let me just very briefly emphasize a couple. So Medicaid waivers, HHS and the President can give. A Medicare waiver to stop Medicare from requiring patient-by-patient documentation of what's done, or to dump everybody into a state-run Medicare managed care firm, that's an act of Congress. So we cannot actually get Medicare into the system without congressional approval. Similarly, we can't get federal retirees and federal workers without congressional action. And I think what that means is that the best a state plan can be is a very partial single-payer plan where there has to be someone making the effort to maintain per-patient billing for part of the system. And as Marvin said, that attenuates a very substantial part of the administrative savings. Exactly how much, we think it's something like 30 to 50% of the administrative savings have to be lost by doing that. Now, I think there are other potential problems that we need to be very clear about. First is, if you can get a waiver for Vermont to do better, you can get a waiver for Alabama to do worse. Yeah. And it's a Pandora's box that we need to be very careful about opening for Medicare. So we've already opened it for Medicaid, and a couple states have done good things with Medicaid. But let's remember that Arkansas has used that opportunity to completely privatize the Medicaid program. So Arkansas is essentially abolishing government's role in Medicaid. And we're concerned that as we press for waivers, we not open the box for states to do worse things. The political power of corporations is highly portable, and Vermont offers, I think, the best case scenario, and it's one of the reasons we've been so happy to see the work in Vermont. As Governor Shumlin said, they seem the best position to resist an avalanche of outside money. And it's partly because there's been such exemplary activism and grassroots efforts there, but it's partly because the scale of political activity in the state allows for person-to-person influence on that would be very difficult in a state like New York or a state like California, where media plays such a major role. One piece which hasn't been talked about is many large employers, most large employers at this point are self-insured, and it's legally a little bit tricky as to whether we can get them to actually participate in this plan, and how. It looks like probably if you have a universal tax, you can get employers to pay it. Probably, almost certainly individual income tax would stand up to federal court scrutiny. But you can't prohibit employers from offering parallel private coverage. That's almost certain. And parallel private coverage is a real problem. There's also a real problem with with separating capital and operating funds. So if you can't get Medicare to go in, remember that Medicare pays capital and operating funds together. And what that means is that hospitals have their claws on the money they need to build the next hospital building. And it makes community health planning much more difficult. So I won't belabor these points. I think the point Deb made at the outset of her introduction is absolutely correct. One can make very substantial and important progress, and politically these efforts can be extremely important to our movement. And yet, actually implementing single payer and achieving the full benefits of what can be achieved requires Washington's work. And so I think as we think about the relationship between state and national work, my view is that these have to be part of the same effort. They're inseparable. And the state work can certainly feed our national efforts. It certainly can't go forward over the long term without the national efforts to support them. So